Hello, everyone. Thanks for joining us on our media briefing for this Monday. If you are on the other end of the line, unless you're speaking, please.
Welcome to Zoom. Enter your meeting ID followed by.
Thank you. Again, we're going to get started. We are going to start our briefing with an update from our Emergency Operations Center and Gerry Malais, who's our Emergency Services Manager. Good morning, Gerry.
Yeah, good morning. Thank you, Maya. I don't have the agenda in front of me. Can you tell me what I'm briefing on? I apologize.
Oh, sure. We were hoping you would give us an update on current operations at the EOC and particularly looking into the next phase as we move into phase 2, how that might change needs at the EOC.
Okay, thank you. For everybody on the call, everybody has been informed that the EOC is operating at a level 1. That is not going to change anytime soon. We have approximately 112 people assigned to EOC positions at the current time. What we are looking for is, I have instructed the EOC staff to try to identify replacement personnel so that as the shelter in place becomes more relaxed and we go from phase 2 to phase 3, we expect many of the county departments to begin resuming their normal operation. And so many of the people in the EOC will be pressured by their supervisors to return to their normal work function. And even though they're disaster service workers and have an obligation to be here, we really encourage a share the wealth perspective so that we can identify other people that can then come and do their part in the EOC. Obviously, a lot of that takes additional training for possibly new people. And so we're trying to get ahead of that curve by identifying people now. And I've asked the people that are in the various sections, branches, and units to identify their replacements. My position is that they are in a better position to know who would be qualified or could possibly do their job, and then they could just possibly train that person to do that in the future. So that's kind of where we're at in the EOC. We, by all modeling and projections, expect this emergency to last and have a EOC activity involvement for several months at this point. Is that kind of the update you were looking for, Maya? Maya, did you hear me?
Are you muted?
I think I am. I just gave
no, Gerry, we can hear you. I think Maya in the Essalon room is having unmuting difficulties. I can see it going back and forth.
Can you hear me now?
Yes.
Great,
yeah,
thank you. And thank you, Supervisor Adams, for piping in there, because you are just the person that I was going to lead into after Gerry's update, because one of our very valuable partners in the EOC is 211, and you know everything there is to know about the origins of 211.
Thank you. And if this is the time for me to weigh in on that, I'm really delighted to have the opportunity to do so. When I was president, thank you. As president and CEO of United Way, we launched 211 in 2009 with a terrific coalition of community partners that worked with us. We had Monterey Transit that came up with these giant billboard ads that they put on the backs and the sides of buses advertising it. It was really kind of cool because we all got our friends and neighbors and relatives to be the models in the ads so that we could get people's attention in the various neighborhoods where the buses would go and where 211 would really make a difference. Department of Social Services, First 5 Monterey County, the Health Department, Community Foundation, Monterey County Foundation. Those were some of the partners that we pulled together to be able to fund 211 to really get it out to the public. When we first started it, it was available in 176 different languages because of a contract that we had with Language Line, which was a company that was here at the time. But I think honestly, it was really the community partnerships that made the biggest difference. in launching 211 and to having it be such a very successful and well-regarded entity. When we pulled it together, we tried very hard to have the call center based here in Monterey County, but there was no entity that was large enough and that had the capacity to be able to do that. So we chose to go with a company, a nonprofit organization in Ventura County, where several of our colleagues from United Ways around the state already were contracting with them to be able to do their calling. Of course, the calling response was terrific with the data that with the telephone answers that they already had on board, who were very experienced. But the data was only going to be as good as what we put into the data bank, because that's really the part that was key to ensure that the telephone people had the absolute most up-to-date information. And it was at the point, particularly when it was in its nascent stage, when we would see they were doing a burn at Fort Ord, and we would call the place in Ventura and say, hey, make sure that you know that this is going on, because people are going to be nervous about seeing all the smoke in the air. Be prepared to be able to give advice on where they can go if they have any kind of lung or health issues. So it was then, and I'm sure Katie will talk to us about that, it still is a very nimble and flexible way of providing information to the community. The first time that we actually, I think, had a seat at the table in the Office of Emergency Services, or the Control Center, was when there was a tsunami threat in 2011. And that was the first time that 211 had a seat at the table, and then, of course, has remained an important partner in getting information out, especially at a time like this, which is unprecedented. So I'm very pleased with what we were able to do. It wouldn't have been done without a whole lot of people, community support, and I'm very, very pleased to see that it's still continuing to go well, and that Katie Castagna, current president and CEO of United Way, has just taken it to another height. So thanks for the opportunity to get to talk about its beginnings. I look forward to hearing Katie bring us up to speed on where we are today.
Thank you, Supervisor Adams. And with that fantastic introduction, here's Katie herself to bring us from the origins to current day and what's happening with 211 in the Emergency Operations Center now.
Thank you, Maya and Mary. It's been a real honor to be part of the community response to the pandemic. And early on, we envisioned that 211 would always be part of our county's disaster response, but it's definitely proving that point. None of us imagined a disaster of this magnitude. And as we move through this difficult time, I just want to remind all of us that one of our biggest defenses is information, and the ability to give people access to information, which is changing very quickly. But 211 has been very well positioned to be able to answer people's questions, work hand in glove really with the county departments, specifically the health department, and making sure that we're getting people accurate information as it emerges and evolves. We've been really fortunate to have such support from the County Office of Emergency Services, and we participate in the daily briefings there for two purposes. One is to make sure that any new information we're able to communicate to our 211 system, and then also to be able to reflect back to the county and to our response the needs that we're hearing from the community. And unfortunately, the needs, have been focused very much on food and housing and shelter. And as we're all concerned about our food distribution pipeline, the information has been very iterative as far as what we hear from the community, how we're able to provide access, working with all of the distribution sources out there. And 211 is a very dynamic linkage. We've also been able to respond to people throughout the county and in English and Spanish. And as Mary said, we have the ability to translate into other languages, but I think primarily it's Spanish, and we have many bilingual call specialists. But going back to that, that role and the need for information, I think one of the biggest things we can do is to prevent panic as part of our response, and to have a warm voice on the other end of a phone call is a big step toward doing that and helping people navigate during uncertain times. We've been very active in updating our resources because, as you can imagine, many services have changed and shifted during this time. So we're constantly updating the information that we have. And we also are available via our website, which is 211montereycounty.org. That's a searchable website if people know the services they're looking for, but there's a lot of hyperlinks to key information that we know is important. Many of our calls have also been related to the shelter-in-place orders, the face covering orders, and really people trying to figure out how to navigate in new and changing conditions. And so being able to have direct links through our 211 site and then the ability to talk to somebody 24/7, I think has been really invaluable. And we really appreciate the opportunity to work so closely with the county in this. We also see daily fluctuations. Often there's increase in calls after the governor's press conference when he announces a new service. Some of you may have heard about the Great Plates restaurant delivery program that was announced, and we're still putting into place locally, but it's a partnership with local government and restaurants and 211 to provide food access, increased food access in the form of delivered meals to qualifying senior citizens. So it's through the network that we have throughout our state with other 211s that we're able to very quickly provide an easy way for the county to collect names and enrollment for our local community. So it's a partnership that keeps building both locally as well as through our counterparts throughout the state. And we're hoping to continue to keep our community strong as we weather this difficult time.
Thank you, Katie. And I hope I didn't miss something that you might have said during your presentation. I know every morning as part of the briefing, you give the number of calls that 211 Monterey County gets. And would you say it's an average of between 80 and 100 calls a day?
Yes, it's fluctuated, but yes, probably between 80 and 100. I can tell you in the month of April, we took over 2,200 calls. Weekends are lighter, and there's spikes when there's a new shelter-in-place order or a new announcement. But yes, but you can see that volume is huge, and it's about 2 to 3 times what our normal volume is during this period.
Wow, thank you very much. And so that's our presentation on the EOC and 211's participation. All these people need to leave it earlier than our briefing will last. So if there are any media questions right now for Gerry Malais, Supervisor Adams, or Katie Castagna, this would be the time to ask them before they need to leave. Sarah, do you want me to ask your question or do you want to ask it?
I did just unmute myself, so I can ask. I'm trying to follow these protocols. Katie, when you and I last spoke, part of my question, and I'll follow up, is it seems like the majority of calls to 211 have been about food availability. And I wonder, given the additional federal aid that's made unemployment checks bigger than they would be by $600 a week, are you finding that it's because unemployment is still not enough to cover food? Are most of the people who are calling unemployed, or are they not able to get out and go to a grocery store because of COVID-19 risk? What are the factors that are contributing to this need for food pantry information?
I think there's a number of factors. We don't collect that information specifically, but I can tell you what I know about our community and the way that relief is provided. So some people, if they haven't needed to file a tax return because their income was so low in the past, they may not have received a relief, a stimulus check. Other people may have filed their taxes but not done it electronically, and my understanding is many of those payments have not yet arrived. And then finally, and what is a very large component of our community is people that are undocumented who may be working, but they're not really registered in our formal Social Security system. So I think it's a number of reasons why people may not even be either eligible or received yet their relief payments, and have been immediately disadvantaged by losing their jobs early on. And so therefore are needing to, in some cases, choose between paying rent and eating. And fortunately, in the short term, there's eviction prevention measures put into place, but we're really concerned about what happens when those moratoriums are lifted. And so it's really a combination of financial distress that many people are finding. And it is ironic because some people are still employed and other people are receiving what is a comparatively generous benefit as far as the additional unemployment insurance, but it's not reaching everybody.
All right, thank you. Are there any other questions for Katie or Supervisor Adams or Gerry Malais before they need to drop off the call? Okay, there are none. Thank you all very much for participating, even in the short time that we had.
Thank you.
So much.
Thank you. All right, next we're going to turn to Dr. Ed Moreno, our public health officer, who will give us an update on public health and all things related. Hi, Dr. Moreno. You'll need to unmute.
So today I just want to welcome everybody, let people know that we're still working on expanding testing in Monterey County. That includes the addition of Optum services here in Monterey County, and we have two sites, Salinas and Greenfield, and they started last week, and they're continuing. And I just want to remind the media and folks listening that we really were encouraging first responders and healthcare workers to get in and get tested with whether they have symptoms or not, so we can make sure that any of our first responders or healthcare workers who might be positive and infectious but don't have symptoms would know as soon as possible, so they could protect their families and not be in the workplace, potentially exposing other people. But we really, moving forward, we really want all essential workers, people who are in food, for example, industry, just as an example, to be tested to make sure that if you know you're positive, we can take measures to make sure you're protecting your family, your household members, and also not exposing your coworkers. So we're very, very happy with having that addition of Optum here in Monterey County. And if we continue to if we can maximize the number of people that are tested at each site on a regular basis, and right now it's they say they can test 132 people per day. We want to max that out so that the state allows us to continue to keep those two testing sites here to be available to the public. We also have, as I mentioned, each of our hospitals now have the ability to test at their hospitals, and with that, they can get an answer within. It takes about 30 minutes on average to actually run the test. So within an hour or so, they can get the report back to the treating physician. We continue to have an intensive contact or case investigation and contact investigation, and we have about total contacts to date. I'm sorry, about 277 cases, that have been confirmed here in Monterey County to date. And we've been able to reach over 98% of all the cases in Monterey County. When we identify a case, we identify at least on average about 5 to 6 people who were considered close contacts to the cases. And so the total number of people that we identify as close contacts are a little over 1,400 people. And so we're also contacting a little over 98% of close contacts. So we have a high percentage of cases and contacts who are being made aware that their tests are positive or that they've been exposed to someone who has COVID-19. So, and on average, we have about 110 individuals of the 277 people that are confirmed cases. At this point, we on a day-to-day basis, we have about a little over 100 contacts that we're following on a daily basis as needed to make sure that they are check how they're doing, and if they're not doing well, they know what steps to take if they should need to receive some health care. So we have those, and it's about 110 that our case managers are working on a daily basis to follow up on. Let's see, and then so that's our case. We are also adding, continue to move individuals from other parts of the department into the case investigation group, so that as we anticipate getting more confirmed cases because of the enhanced testing, we're going to need more folks calling the confirmed cases and identifying who they might have exposed. We have some help coming from the state very soon with this effort, this containment effort. We have statewide training that begins this week for some counties who've been chosen to be pilot counties, and those eventually all of our staff that will be assigned to the tracing will receive not only the training that we provide from our experts here in the health department, but also what the state is looking to provide moving forward. There's also efforts at the state level to create and share at no cost to local health jurisdictions a statewide case and contact tracing data system, so that we can have greater consistency across all of our health departments for identifying people who are close contact, and that's going to be very helpful for all of us to be using the same system. And then finally, the state is looking to reassign state employees to work in support of local health jurisdictions to add several thousand new case and contact tracers to local efforts. So we don't know how many people will be reassigned to Monterey County, but anticipate we'll be working with them through distance work, meaning working from home in assisting. So we will be able to assign close contacts to those individuals, and they would in turn make phone calls and contact as many people as possible to let them know they've been exposed, that they need to be in quarantine, and what to do if they develop symptoms. So I'll go ahead and stop there and get it back to you.
All right, thank you very much, Dr. Moreno. And with that, we'll go ahead and start with the questions, and we'll start with the questions that I've already received. This one is for you, Dr. Moreno. Last Wednesday, you listed 5 conditions which you called indicators of readiness to release restrictions that would need to be met before the shelter in place was eased. And on 2 days later, Friday, May 8th, you revised the shelter in place order, and that was the supplement. How did the county meet those conditions in just 2 days?
So yeah, thanks. So actually the indicators that we're discussing that I shared were a sample of indicators that were under consideration for use in moving forward through this pandemic. And since then, the governor has released specific indicators that each county needs to follow if we're to move forward, to continue to move forward at or faster than the state is recommending. So those are the indicators that the state has put out, and so those are the ones that have our greatest attention at this point. As I mentioned, this pandemic is an ever-evolving event. Things change from day to day and week to week. So now we have the indicators from the governor, and those indicators are for readiness for moving forward in stage 2 include that we have to have epidemiologic stability, we have to have adequate testing capacity, we have to have adequate containment capacity, which is the contact tracing. Our hospitals have to have capacity to tolerate surge, and we have to demonstrate that we can protect our vulnerable populations. So those are things that indicators that we now will need to focus on and spend more of our time on, because the other counties are looking at these same indicators as a minimum for deciding when to release some restrictions.
Thank you, Dr. Moreno. And here's your next question. What is the relevance of the state's epidemiological benchmarks, the daily tests, new cases, deaths over 14 days, contact tracing, et cetera, on the county's current supplemental shelter-in-place order and future business reopening phases? How close is the county to meeting those benchmarks, and what is the plan for meeting them?
Mm-hmm. So yeah, so thanks. So that's what we're looking at. I'll just point out one. There's in order to attest that we're ready to move forward further through stage 2 of the governor's plan, we would need to have no patients with COVID-19 die in the past 14 days. And my epidemiologists are telling me that we've had at least one death in the last 14 days. So we have some work to do to continue to try to epidemiologically show that we have that the number of cases and the number of deaths in Monterey County is stable enough to really allow for further release of restrictions. So yeah, we're definitely looking at all of these, and looking forward to working with Charles Mckee to provide a more thorough assessment of when we think we might be able to achieve these indicators for moving forward.
Thank you, Dr. Moreno. And this is another question regarding the stage 2 and readiness. The governor will allow counties to move through stage 2 more quickly if they can show they meet the state's readiness criteria. Once it's been, for instance, once it has been 14 days since the last COVID-19 death in Monterey County, is the health department planning on submitting its own readiness plan to the governor?
All right, thank you, man. So thanks. As I just mentioned, we've had at least one death in the last 14 days. So on that particular parameter, we haven't met the criteria, but that's just one of several that I mentioned that we have to meet. So we have to, basically we have to attest, or I would have to attest to the governor's office that we meet all those criteria. And if we don't meet those criteria, I have to explain why. And then we would, and then at that point, we would be able to propose to the governor how we meet those criteria, or how we think we're going to meet all those criteria if we haven't met them all in the future, and to move forward through stage 2 as was mentioned. So thanks.
Yeah, and may I just to jump in to reiterate what Dr. Moreno said, it's not just one criteria, there's several several pieces of criteria, which also include, zero cases per 10,000 population, as well as other issues. So it's not just the death criteria that we're looking at to need to meet in order to move through phase 2. And then we have to put together the plan and have it go through the state.
Thank you, Charles. Dr. Moreno, another question for you. Is County Health still projecting 33,000 local coronavirus cases and 900 plus hospitalizations at the local peak? Are there any new projections, and what are they?
So thank you. So no, I don't have any new projections to share, but I do know that the numbers, again, the numbers are mainly for the hospitals. Again, it's one of the tools that they use for planning. So I'm very grateful that the hospitals have taken this very seriously. They've increased their surge capacity, and we continue to work on alternative care sites and alternative housing sites for individuals should we or when we get to a surge. So again, it's just that modeling is just a tool. The outcome is based on our local data and a formula that we didn't create. It's just one of many that we can use. So that's I think over time, as we put in a new data in the near future, the outcome would be different, and that's what we would expect.
Thank you, Dr. Moreno. And there was a second half to that question, but I broke it up just to make it easier. If the peak of the virus in the county has been delayed, is there any new projection on when it could occur?
Oh. So fortunately, the way we've progressed now for I think about 6 weeks is that we've been able to keep the doubling time pretty steady. It's still around 14 days. That's the time it takes for the number of cases in Monterey County to double, and it will continue to double because we're in a pandemic, so we'll continue to have cases. But because we've been able to, fortunately, keep that steady, the peak will continue to move further and further out. And so I think it's important for it's important for us to continue to have people go out there and get tested, so we know how many people, a better estimate how many people in Monterey County actually have or have had the infection. And I think that's again, that's why I'm encouraging people to take advantage of these new testing sites. It provides us better data and gives us a better idea of whether how quickly it's spreading. But for now, I think as a county, I think people in Monterey County, many of them have been doing the right thing with social distancing, sticking to their households, not trying to mingle with people from other households as much as possible. And moving forward, I really look forward to seeing what the results are of all this additional testing. We've been asking for additional testing capacity for months now, and now we're getting it. So anyone out there who wants to get a test, if you have mild symptoms and you've got people in your household who are vulnerable, you're living multi-generational families with older individuals living in your household, and you're going to work, but now you have symptoms, that's a good idea to get checked, because if you're testing positive, you want to separate yourself, isolate yourself, and separate yourself from grandparents or people who are vulnerable, like people who are on dialysis that living in the household. You want to know. It's better to know and separate yourself so you don't infect people in your household.
Thank you, Dr. Moreno. Here's another question regarding cases. According to your office's latest statistic, 40% of the county's coronavirus cases are among agricultural workers. Is the surge of cases among these workers under control?
Thanks. So yeah, so we have in Monterey County, we have quite a bit of testing being done in the Salinas area. We have 2 hospitals who can now do their, who are collecting specimens, and they can do testing in their hospitals. They can send their tests to Quest or LabCorp. They can send their specimens to us. And now we have a testing site in Salinas as well. So we have a lot increased capacity in the Salinas area. So we're getting a lot more tests, and the Salinas hospitals and also provide a lot of healthcare to farm workers. And so we're fortunate. I'm grateful for that we have a couple of hospitals serving our ag working community. And so we do have an increase, relative increase in or relatively more cases confirmed among ag workers than other sectors in the community. So I think that part of that is because, as I mentioned, we have a lot more testing in the Salinas area for ag workers working in the area. We also have ag workers who are living in some form of employee housing. That could be H-2A, provided housing by employers, or it could be another living arrangement that's permitted by our environmental health department to provide employee housing. So we have groups of farm workers living together, multiple people from living together and working together. So that's what we call a congregate living, congregate living setting. And that, so they, any one person, if one person in that group, that household is diagnosed with COVID-19, the other members of the household may be considered close contacts depending on the living setting. And so we are all concerned. Mr. McKee's concerned about it. We're concerned, the Ag Commission is concerned about it. I'm working closely with our environmental health director to work closely with as much as we can with the industry on making sure that the industry that provides, any business that provides employee housing is following not just the state standards for housing of individuals, but also updated requirements that we put out to those overseeing employee housing to promote cohorting and distancing among the workers in those living conditions. So there's several things I think that are contributing to the increase in testing. And then I'll add one more. A lot of our advocates for farm workers and farm worker health have been working with industry to recognize the importance of our ag workers and their families. And so there's been outreach in the fields, there's been outreach by employers, outreach by environmental health and others to let farm workers know that their health is important. And if they feel that they have symptoms that need to be tested, that they shouldn't, they should seek health care. And so I think that type of encouragement and support that's coming from the community to our ag workers is also meaning that more of our ag workers are getting access to healthcare and testing. And I think, again, it's important. I think it's still important, better to know if you're positive or not to do it so that we can work with, as much as possible, the ag community to try to isolate ag workers to preserve as much as possible not just the health of people who are being diagnosed, but also the health of people who we can prevent from getting exposed. So a lot of factors leading in, I think, that contribute each in part to the increased number of ag workers being diagnosed with COVID-19.
Thank you, Dr. Moreno. And I have a related question on farm workers. This report is looking for how many farm workers have tested positive to date. And if, I don't know if you could answer or if Christy Mckee is on the call and she might have that number.
I have it, but Christy, if you're on the call, would you like to answer that?
Good afternoon. Yes, so we have had 110 agricultural workers test positive in Monterey County during this epidemic. And if you aren't aware, over the weekend, we did start publishing that some information of cases by employment industry on the website at www.mtyhd.org/COVID-19. So that information is available and is being updated by industry sector daily.
And Christy, just to clarify, that's all self-reported, right?
It is. So when we do our case and contact investigations, we ask individuals a variety of questions. One of them is about their employment and where they work. And so this is from the information that has been provided to us by our clients.
Thank you, Christy. And a question for Dr. Moreno. Monterey County is still testing only 790 per 100,000 compared to Santa Cruz, which is testing 1,722 per 100,000. How can we know when to reopen when the county is so far behind in testing?
Okay, so I'm sorry, I can't confirm those numbers. Maybe Christy can. But what I want to point out is that in order for us to, as a county, to convey to the state that we've met testing requirements to move forward, we need to be able to show that people are being tested. It's not just the total testing capacity, it's how many people are actually getting tested. So what we need are to make sure is that do what we can and working together with hospitals or testing locations, healthcare providers, employers, and advocates to get people to seek healthcare if they're not feeling well, and where they can get possibly get tested, and also people to make best use of the testing that we got with the Optum services. We really need more people to get tested, and not just. And so we have some capacity right now that exceeds the number of people getting tested. So we can test, for example, in our laboratory up to 120 people a day. That's just one laboratory, and there's many other laboratories now that are up and running with testing for COVID-19 virus. But in my laboratory, we can test up to 120, but we don't always get up to 120, which means there's more. We have capacity that exceeds the actual testing. So as a county, as a community, we really need to get more people tested, so we have a better understanding of how many people out there over time have COVID-19, so we can get better trending data to analyze and then present to the state.
Thank you, Dr. Moreno. Another question for you. Given the number of people who commute from the Salinas area to the peninsula and the higher incidence of COVID infection in the Salinas area, how will that inform future decisions on easing shelter-in-place restrictions?
So as a jurisdiction, we recognize that people travel within our county to work. We have people who travel across our county borders to work as well. So I think it's important that we think both locally but also regionally, and because of that, it's important that Mr. Mckee and I and others work and continue to have good communication with each of our cities. And as we continue to develop strategies to move us forward, and also work with our neighboring counties. And so we do work with the health directors from, for example, San Luis Obispo and Santa Cruz County, and the health officers in those counties as well. And I know that our county councils and CAOs are also in communication with their colleagues. So we have to think not just locally, but also regionally about travel within our county and between our counties. I think moving forward, it's going to be important that we have some consistency across our county and also across our region, so that it's as simple as possible for people to know what activities are necessary and allowed, and what limitations there might be, so that it's easy for people and they don't have to think about, when I'm in Salinas, this is what I do, but once I go over to the peninsula or South County, I have different restrictions. So we don't want any differences from region to region. They just make it too complicated for our community. And we are one community. We are one county, and we have to work together through this. We depend on each other for employment, for work, and we need to continue to work together as one community in Monterey County to get through this.
Thank you, Dr. Moreno. And here's a question, it's not quite the same as a question you answered a little bit ago on modeling and projections. You mentioned a few weeks ago that an updated model projecting the county's peak would be provided. How close are you to being able to unveil that model?
So what we're looking at, I believe what our epidemiologists are looking at is, what we want is we've got a big jump in testing capacity that just went into place. And so we have the previous model, and what we'll probably want to do is start looking at what data will come out of running the formula in the model when we have more testing being done, because that's going to have the biggest impact on the output that comes out of this model, more testing. And so again, if whatever we can do to get more people out there testing, the more data we have out there, it's going to be better for us to get more reliable information that we can share with the hospital. And when we have that information, we'll be meeting with the hospitals to go over it and see if it's still of any use to them in their surge planning. I suspect that as our hospitals get closer to completing their plans for surge, and then the modeling will have probably served its purpose, and then the hospitals will just continue to maintain a level of preparedness to surge if possible. At that point, we'll be in a better place when we have all of our surge capacity implemented and ready to activate. And at that point, the hospitals will be depending on us as a community to continue to avoid situations where we're unnecessarily exposing each other to COVID-19. And they'll also be working with us and relying on us to identify and contact every confirmed case. And as long as we continue to receive support locally and from the state, we will continue to attempt to contact every close contact to make sure they understand the importance of quarantining during their incubation period.
Thank you, Dr. Moreno. My next question is regarding farm workers who have tested positive, and have they been isolated in hotels or trailers? I'm going to have to forward that question to our Emergency Operations Center Care and Shelter section, and I'll forward that question and get a response for you hopefully this afternoon on that one.
So I can briefly answer that.
Great.
Actually, it looks like Charles wanted to answer.
All right.
Well, either way, I was going to say that farm workers, just like anybody else who have tested positive and cannot isolate themselves satisfactorily in their home situation and have no alternative housing, we are housing them in our in motels at this point. That's where everybody's being housed, and I know that the agricultural industry is also housing their workers as needed in the same kind of situations. And they may even be housing a little more broadly than just those that are coming through the system who have tested positive, in addition to those who have been exposed and may need to have some isolating situations that they can't do at their home.
Right. Thanks, Charles. I just want to add that a lot of the folks that self-identify as working in the ag industry, a lot of them are families that live here year-round, and their kids go to school here, and a lot of them, in talking to them, can work with us to identify a way to isolate in their own homes. And so that happens quite frequently. Usually where we struggle is with farm workers who don't live here year round. Their families aren't here. They migrate, or they're in H2A housing. And so that's where it's difficult because some of the H2A housing isn't conducive to isolating. Some of it is if they're living if a labor contractor has made arrangements to use a residence, a single family home for employee housing, they might still be able to figure out a way to isolate one person who has COVID-19. So it's really on a case-by-case basis, but a lot of them are families who live with us. They're part of our community, and the kids go to school here, and they can figure out a way to self-isolate. So fortunately, we're working with the ag industry and our Emergency Operations Center to help to isolate people who can't. There's just no way they can isolate themselves.
Thank you, Dr. Moreno. Another question for you. When you say we can know how many people have had the infection, is that referring to antibody tests? is the county health department collecting data on antibody test results, and are those tests reliable?
So first of all, the testing that we have right now that that provides data that informs decision making is virus testing, and the virus testing is what we're putting on our website. And so when we have more people testing, we'll have greater number of people tested and what percentage of those individuals were positive. And so that, especially as you start moving into testing people who don't have symptoms or people who have mild symptoms, that gets us closer to a group of people who are tested who look more like the general population. And that's really where we get some good, I think, start to get some better data, more data, and data that we can actually make some estimates of what the, hopefully what the incidence is of COVID-19 in our community. And so again, folks, if you're not feeling well, we have testing now. Go out and make good use of it and do the right thing. If you're positive, isolate yourself, and our staff will contact you and help you through this to make sure you don't expose other people or in your household or at work. As far as antibody testing, at least once a week, I check with Dr. Ferguson, our public health lab director, to find out if there are any laboratories, if there are any providers out there that are testing, ordering tests for antibodies. And as far as let's see, this past I think Thursday, Friday, she informed me again that currently there's no testing of antibodies that here in Monterey County that tell the person who's being tested who has a positive test if they're positive because of COVID-19 specifically, or if they're positive because they might have had a coronavirus infection at some time during their lives. So the test that we have right now still can't tell the difference between a coronavirus infection someone had years ago and a COVID-19 infection that they recently had. So that data, at this point, we couldn't use that data for the purposes of determining what percentage of the population has been exposed to COVID-19.
Thank you. And another question, if the county has a limited number of new cases and no deaths in a 14-day period and meets the state criteria for further reopening, but then has too many more cases and deaths, does that change the reopening status? And would the state require the county to revisit or reverse its reopening?
So that's a good question. So that question has come up in our discussions with the state. The state has not, the purpose of the attestation and meeting the thresholds for the indicators is for purposes of determining readiness. Are we ready to move forward through additional phases of stage 2? That's readiness, but it doesn't predict the future. It just means at this point, we believe we're ready. And so as we move forward, the state does recognize that any time, and I and my colleagues recognize that anytime we release restrictions in our community, it increases the opportunities for people to leave their home for other activities, which does come with a chance of more exposure or opportunities for exposure to COVID-19. So we and the governor both, and my colleagues and the governor all recognize that we may demonstrate that we're ready and move forward, but we have to recognize that every time we release restrictions, there might be there's a chance that the number of exposures have gone up significantly in the community as a result of releasing restrictions, which could drive up the number of new cases, which could drive up the number of hospitalizations and deaths. So the governor does include in his statewide plan, or does recognize that there may be a need to hold off on future releases of restrictions, or if necessary, if it's a significant increase in hospitalizations and deaths, actually reinstitute some restrictions to slow down the spread of the virus before moving forward.
Thank you, Dr. Moreno. And this is a question for Christy. To clarify the 110-person figure for working in agriculture, is that specifically field workers, or does it refer more broadly to people who work in the industry, such as coolers, trucking, and pesticides? The broader definition is what we have been using in the past.
Excellent question. Thank you for bringing it up. Yes, it refers to the broader industry. All of the categories that we've shown out on the web site for occupation do refer to the broad industry and all of the occupations that are associated with that.
Thank you, Christy. And our last question on chat, and we're running close to the end of our hour, so I'm going to take this last question. How much, and this is for Dr. Moreno, how much of an influence on the higher numbers of COVID cases in zip code 93906 was related to a nursing home outbreak, and how many COVID cases have been identified in that and other nursing homes? Are local nursing homes prohibited from refusing elderly even if they are COVID positive?
Okay, so a lot there in that question, which is
Yeah,
fine.
sorry.
It's fine. It's fine. I mean, this skilled nursing facilities and the remaining long-term care facilities they're important in our community. They provide a really important service to our county residents and their families. So we do what I can maybe is probably well, I'll try to answer a question by describing what we've been doing in working with skilled nursing facilities. So I'll acknowledge that, yeah, skilled nursing facilities have, like any other business, run the risk of having employees coming to work that have COVID-19. We've had employees from all sorts of businesses across the county in many different sectors test positive. And so we would expect that there could be some healthcare workers in skilled nursing facilities that are positive and don't know it. So what we're really trying to do is what we have done is worked with the skilled nursing facility management and their infection control practitioners to make sure that they are aware of and understand and following the federal and state guidance issued by Department of Public Health and the licensing and certification sector and OSHA as it pertains to skilled nursing facilities, to make sure they're following the strict requirements to prevent the spread of COVID-19 in those facilities. And so testing of healthcare workers, including those in skilled nursing facilities, is very important. If anyone is working in a setting like that and they develop mild symptoms, the recommendation is to go get tested, because if they're positive, they need to be removed from the work site so that they're not spreading it to their coworkers, and definitely no longer spreading it to people living in the skilled nursing facilities. So as we move forward, we will continue to work with skilled nursing facilities. We also understand that the skilled nursing facilities have concerns about transferring their residents to and from the hospitals. And there is guidance that comes out and is revised periodically from the state to both hospitals and skilled nursing facilities to provide the best practices on transferring people who have had COVID or might be suspected of having COVID to and from a skilled nursing facility and the hospitals. Christy Mckee and our team have been quite involved with those discussions with the hospitals and skilled nursing facilities and their leadership. There, as you can imagine, that on both sides there's concern about transporting and housing people in skilled nursing facilities who are suspected or may have had COVID-19. But the important thing is that we are getting, it's not the first time that we've done this. Our team has worked with skilled nursing facilities in the past with yearly influenza outbreaks, H1N1 pandemic, and gastroenteritis, just a few examples where we get outbreaks, and we're employing many of the same techniques that we've employed for years with skilled nursing facilities to slow the spread of viral infections. What we're doing now is using those same techniques, modifying it for pandemic influenza, and working closely with the management for skilled nursing facilities to slow down and contain any cases in their facilities.
Thank you very much, Dr. Moreno. And we are at 1 o'clock, and that is all the time we have for our media briefing today. Our next briefing will be Wednesday. Thanks for joining us. We'll see you then.